Good morning, everybody. I'm Clayton Cheever. I'm the Assistant Director at the Thomas Crane Public Library, and it is my honor and pleasure to welcome you to our ongoing Fall Prevention Stress Management for Aging Adult series with Nurse Debbie Toomey.
Good morning. Thank you so much, Clayton, for having me here again. And I want to thank the Quincy Public Library for allowing me to continue my work in helping the aging adults learn about falls prevention and also stress management. And so today I have two guests, and they are amazing nurses from Tufts Medical Center. I'm going to have them explain more who they are, what they do, but I'm telling you, you're in for a treat today. Before I do introduce them, I just want to share that I am the injury prevention coordinator for Tufts Medical Center's trauma department. And a lot of what I do is basically doing a lot of workshops and training and outreach to be able to spread the word and the tips and the tricks on how to stay healthy and independent and live a quality and happy, healthy life. All right, so before I go on here, I just want to make sure everybody, Kathy, Tom, okay, you're there, awesome. All right, so Kathy, Tora McHugh, and Tom Gunning, please begin and introduce yourself and share with us some ways how we could reduce our stress during these difficult times. Go ahead.
Thank you, Debbie, and thank you so much for inviting us to come. We're very excited to be here. Thank you, Clayton. We're very happy to talk a little bit about what's going on in the world and in mental health. So my name is Kathy McHugh. I have been a psychiatric nurse at Tufts Medical Center for the past 30 years. I'm completing an internship as a nurse practitioner. And I think that over the past 30 years, I have never been involved in a pandemic. This is new for me as it's new for you. And so I look forward to spending the next half an hour or so with you. But I do want to introduce Tom Gunning.
Thanks, Kath. Hi, everyone. My name is Tom Gunning. I work closely with Kathy McHugh on a 20-bed inpatient unit at Tufts Medical Center, and we care for psychiatric patients. My role on the unit is the professional development director, so I do a lot of education and in-servicing, not only with the Pratt II staff in terms of psychiatry, but around the hospital. Both Kathy and I do a lot of consultations with people that might be having some psychiatric problems, but are in the hospital for different reasons. So we do a lot of work with people that, we're suffering from stress, anxiety, mental health issues. So it keeps us busy. And I agree with Kathy. We're really happy to be here today.
I would like to talk a little bit about some of the topics that have come up during COVID. And one of the topics that I've seen a lot is grief. I think that COVID has brought up for patients, for people in the community, the isolation, the loss. Some people have lost family members and friends. Some people have not been able to go to services, and it's left people kind of hanging. I'll give you an example of two people, actually. The first person is somebody who herself had COVID. She was in her 30s. She was very sick for a very long period of time. And during that time, she had a lot of losses. So people with COVID go through a whole bunch of emotional feelings. So I myself had COVID. I know a lot of people who have had COVID. Many have recovered, some have not. And I think when you experience this and you've gone through a traumatic hospitalization, it changes your life. And I think when you have friends that have gone through this traumatic situation, it also changes your life. This particular woman was ill for, as I said, 3 months. She has had some physical problems as a result of that. She's having difficulty talking. Her job is very committed to her, so she's able to work, but she's not functioning to the extent that she had been before. And she's experiencing sadness, depression, and she doesn't have the coping tools that she would have had prior to COVID. I have another friend whose mother was ill during COVID. They still haven't had the services. Unfortunately, her mom died. So her ability to get together, to do the services, to reach out to our families and friends has been limited. So I'd like to talk to you about grief and what grief means and how we can get access to supports. What do we do with the isolation? So traumatic events can occur at any time of the year. The holidays bring up grief. They bring up feelings of loss sometimes, even without the pandemic. And I think we don't always have the tools that we need to reach out to our friends and families. We can call, but given now what's going on with the pandemic, sometimes at this point, we're not able to get together with our families and friends. And it brings up that grief and that loss of human contact. As a result, we're looking to provide some tools for you that maybe you can utilize to help you get through this period of time. There are chat rooms that I wanted to just tell you a little bit about. The National Alliance of Mental Illness has a lot of resources for people. They can talk about grief. They look at your mental health conditions. If you're suffering from depression, which is very normal during a grief period of time. However, you could have prolonged depression where you might need to reach out to a provider. And there are providers that are listed under their website. There's also grief groups that you can Zoom into or you can talk to on the phone. Many of these are free of charge. Some have an initiation fee, but they're excellent and they may be a resource for you. I don't know if anybody has any questions about what I'm discussing now or have any experiences about grief during this time.
Feel free to use the chat if you want to say something or mention something, but I'd like to be able to share that. I totally agree with you, Kathy, that it's really a difficult time and it does bring up a lot of maybe suppressed type emotions that, we try to keep at bay so that way we could be stronger for others in our life, or maybe so that we can do our work the best way we can. We try to keep it, under the lid, but sometimes we don't even know it. It can just, our emotions can just blow up. Yeah, personally, we've had a loss in my family as well. And, I can totally understand how, this time of the year, especially, and not being able to gather and comfort each other and come as a one family unit can be very difficult, especially with, the numbers that we have to the numbers that we have to comply with as far as gathering indoors, especially during this time, can be very difficult.
Yes, Debbie, and you bring up a really good point that sometimes people don't even know what it is that they're upset about. So if you find yourself just breaking into tears and you have no idea why, it could happen in the middle of the day. That's all part of reliving a trauma or a grief that's been suppressed. So it would not be uncommon for people to do that. People have been coming in with all of those kinds of symptoms.
Yeah. Thank you. Thank you.
So Tom, we were going to talk a little bit about some coping strategies called mindfulness, and Tom Gunning's going to share with us about that.
Okay, so I'm just going to share my screen here. So what I'd like to do is just kind of share with you a couple of different types of coping strategies, all kind of under the umbrella of what we call mindfulness. You might be familiar with it. It's gained a lot of popularity in the past few years. And basically what the simple definition is it keeps us in the present. So to look at really what mindfulness is about, it's really a mental state achieved by focusing on one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations. Studies show that we spend more time thinking about the past and the future than we do what we're doing in the present. And that has a lot of real negative results. Sometimes we're so focused on the future or we're so focused on the past that we're missing signs that maybe our body is telling us that maybe there's something going on with us physically, but we don't have the mindfulness to be in the present, to recognize or acknowledge those feelings, thoughts, or maybe symptoms. So the whole point behind mindfulness is to keep people in the present so that you can experience the emotions that you're feeling and hopefully bring resolution. When we don't look at things, when we kind of, shove them under the rug, or we are in denial, or we just choose not to look at things, what typically happens is cumulatively, those feelings and all those suppressed feelings, they become much larger than they originally were, and sometimes they have physical consequences. People may develop ulcers, or they may develop anxiety problems. Mindfulness is really about acknowledging what's going on in the present and dealing with those issues. And when we're more in tune to where we are in the moment, we're able to develop the resiliency to deal with the problems that are facing us. And you'll find a lot of therapists, a lot of wellness people, they use mindfulness as a really effective therapeutic technique to really help people, especially with anxiety. And if you're like me or a lot of us, we have a lot to worry about, right? I mean, we're in the middle of a pandemic. We just had a very contentious election. I mean, there's a lot of things going on in the world that really can shift our focus away from us in terms of what we need. And they're all kind of trigger points for more anxiety. So what mindfulness really endeavors to do is to really keep us in the moment and keeping us aware of what's going on in our minds, in our bodies, in our spirits. And it really helps us to kind of take all the negativity around us and kind of funnel it through a more healthy way to deal with that. So it's with that, just kind of a little commentary today. I'll live in the moment unless the moment is unpleasant, in which case I will eat a cookie. So basically, the reason why I like this particular cartoon is one of the things that mindfulness really calls us to do is to not only live in the moment, but to deal with those unpleasant feelings. And sometimes it's just a matter of sitting with those feelings and letting them kind of pass. When we don't acknowledge those feelings, when we kind of, push them in the background, that's when we can start to experience very negative consequences of not dealing with that particular feeling. Mindfulness, in a way, makes us confront some of the things that we're feeling in the moment in order to provide resolution. And that could happen in many different ways. So again, just a little bit more definition about what mindfulness is. So it's a state of active, open attention on the present. Again, we are such a species that lives in the past as well as the future that we totally forget the present. And what mindfulness does, it's like this magnet that just kind of pulls us back into the present and out of the past and the future. So when you're mindful, you observe your thoughts, your feelings from a distance without judging them good or bad. And that's a really important part of the whole mindfulness process, is it's not self-judgment. We're not sitting in a state of judging ourselves. We're just accepting the feelings, the emotions, the situations as they are, and we're trying to positively work with them. Okay, mindfulness has nothing to do with with self-examination in negative ways. It's accepting what is and then moving on for resolution. And when we live in the past and the future, we miss the present. So we could be losing decades to living in the past and the future, and we're really missing on what life is offering us in the moment. And that's one of the things that mindfulness helps us do, is to be aware of all of that. So instead of letting our life pass by, when you do practice mindfulness, you live in the moment and you're awakened to whatever experiences you're having in that particular instance. So to kind of break it down a little bit simpler, you want to focus on one thing at a time. You want to be aware of your emotions and acknowledging that they won't last forever. And you always want to try to stay in the present, or as we like to say as mindfulness practitioners, be here now. Okay? Don't be in the past. Don't be in the future. Be in the present. Just another little quote. Yesterday is history. Tomorrow is a mystery. Today is a gift. That's why it's called the present. Okay? Kind of a little tongue-in-cheek there, but I think the point is really important, is we can't do anything about the past. we don't have enough information to make any decisions about the future. We need to concentrate on the present. It's a gift. And when we choose not to do that, we're missing out on a lot of what life has to offer. So just some reasons in terms of why should you practice mindfulness. Studies show that it boosts our immune system. It increases positive emotions and reduces negative emotions and stress. It also increases the gray matter and regions of our brain linked to learning, memory, emotion regulation, and empathy. You know, and as we get older, those are like worth their weight in gold. I mean, those are really great byproducts of mindfulness that are really important to consider. Mindfulness helps us to focus and tune out distractions. It improves our memory and attention skills. It fosters compassion for others and ourselves. When we can kind of accept ourselves for where we are and where we're at, that self-acceptance translates into empathy and accepting others. So it really does help us, boost our compassion quota. It helps parents, schools, prisons, healthcare professionals, veterans, and more. I know Kathy and Debbie, we can all speak to this. Mindfulness has become a very, very popular practice in nursing, and really in the whole healthcare field at large, but particularly in nursing because of the types of jobs we have, because of the kinds of stress that we face. And in terms of some of the patients that we care for, this is a practice that in our own practice, we can pass on to help patients deal with whatever it is that they're going through. It also enhances relationships. You know, when you're in the past or you're in the future and you can't get out of those realms, what typically happens is your relationships start to suffer because you're missing cues that people may be trying to communicate with you, or you might be missing cues or they may be missing cues that you're giving them. So being in the present, practicing or having a mindfulness practice really helps sustain and enhance your relationships. And I thought this was really interesting that it fights obesity. And then when I thought more about this, it only kind of makes sense. If you're in the moment and you're not fretting about the past or the future, a lot of times I know with myself, food is a great medicinal remedy. Instead of dealing with my feelings, instead of sitting with the discomfort, I'll get up and open up the refrigerator. I'll go to the cabinets and start, foraging on anything I can get my hands on. But when I'm practicing mindfulness, when I'm in the moment and I'm accepting and acknowledging whatever it is that I'm feeling, chances are I'm going to get a much better resolution than going to the refrigerator and, grabbing a snack while my feelings are still left unattended and the emotions aren't resolved. So just something to keep in mind in regards to that. So mindfulness, the end product, translates into happiness. People who practice mindfulness show higher levels of overall happiness. Those have been clinical studies that have been shown that mindfulness has really, really great benefits. So the question I would ask you at this point is your mind full or is it mindful? So the whole mindfulness practice is really a process of decluttering your mind. And it's a discipline, so it takes time to develop, it takes time to practice by shifting from that mindfulness to being mindful. So get the clutter out and start living in the present. The clutter could be the past, the present, the future, but what you want to do is you want to just kind of clear all that out and just be present in the moment. So more studies, what makes people happy has less to do with what they are doing and more to do with whether their attention is fully present in the moment. Kind of makes sense, right? You're much happier when you're in the moment rather than maybe perseverating on maybe mistakes you made in the past or worried about what's going to happen in the future. And I think, at this stage of life when people that are retired, people that are kind of winding down their careers, or that maybe they're looking at retirement, this is a really important time to really focus on the present, because again, you can get so caught up in what the past, what happened in the past, and you could be afraid or concerned about what the future is going to hold. But by staying in the present, your ability to be more regulated emotionally and to be more even keeled, that translates into a much happier state of life, and you're your tendency to kind of get depressed or to get more caught up in things that you have no control of is greater.
And Tom, along with that, what I'm hearing from people is that a structured day helps them to stay mindful because they have a routine. Otherwise, their minds can wander and they focus, and the floodgates open. But structure in the day has helped people a lot.
Yeah, and Kathy and I both know, working in mental health, therapy and medications are really important. But if you don't have structure to your daily life, chances are it's not going to be as effective. So yeah, I second that. Having a very structured life, a structured day is essential, and kind of fighting off depression and anxiety. When you don't have enough to do, or when you find yourself in a space where you're just alone with your thoughts, what typically happens is, your problem might be this big at 8 o'clock in the morning, but if you just spent the last 4 hours thinking about it, it's now exponentially bigger. And now that's going to be a huge source of anxiety and depression. So I can't stress enough that having a structured day every day is really important to not only maintaining good mental health, but to support the mindfulness practice.
Can I add one more thing, Tom?
Yeah, absolutely.
I totally agree with what you and Kathy shared about having a structured day, but also having a structured evening. Because so some people might say, okay, I'm going to be doing this from 9 to 5, and then what happens when you get home all alone? It's getting dark outside. That's when things starts playing, in your mind. So having a nice way to kind of ease or end your day, creating some sort of a sleep hygiene or something that you could do to help you transition from your day life to your evening to night life. Because as we all know, as clinicians, self-care is important, but also, under that is sleep. Because, our minds can start playing these wonderful tricks on us in the evening when it starts getting darker, when, all of our responsibilities for the day has gone. And that's when, the quiet mind and the tired body starts playing this, ugly dance. So having a nice way to take care of yourself in the evening so that you could ease into sleep and have a great night's sleep and then start your day again.
Yeah, that's a great point. The evening is equally as important as the day.
Yeah.
Waking up in the middle of the night, Debbie, along with what you're saying, people waking up in the middle of the night with perseverative thoughts or thinking over and over again about their concerns and their problems is a huge precipitant. It kicks off not being able to concentrate during the day. The problems are getting bigger. So sleep hygiene, I think, is really important for good mental health.
Yep.
So let's see. So here are a couple of tips in terms of how do we practice self-care. Some of these might resonate with you. And feel free, if you just Google mindfulness or self-care, the internet is full of ideas and everything from apps that you can download for mindfulness meditation, guided walks, anything like that. There's so much available for free online. If you just do a quick Google search, you'll come up with more things than you probably could even get through. But making a date with yourself, again, that speaks to the structure. Make sure your time is structured in a healthy way. Give yourself some credit and some accolades. Praise yourself when you do something awesome. We're so negative towards ourselves sometimes, and we don't give ourselves enough credit for the things that we do, for the things that we've endured, for the achievements we've made. Cut yourself some slack and give yourself some praise. It really goes a long way. Sometimes just by unplugging. The world gets more complex, it seems, every day, and we get so full of stuff that, some of it's pertinent to our lives, some of it isn't, but sometimes we just have to unplug. And however that works for you, it could just be, getting home, closing the door, making a cup of tea, and just sitting in your chair and just kind of like de-stressing that way, just kind of emptying your mind, relaxing your body. Some people find journaling really helpful. Sometimes you have a lot going on in your head, and our brains think much faster than sometimes we can process. The act of journaling, the act of writing, slows down those thoughts and really helps us gain a little bit more clarity or pay attention to things that we might have missed if we just kept them in our head. So journaling is really effective for that. Meditation, there's just lots and lots of information that points to meditation as being one of the best ways to handle and manage stress and to just really, give you overall physical health. Take a class for fun, something that feeds your soul. If you like to cook, take a cooking class. If you're an artist, take a painting class. Find things that you like to do and fill your life up with those things. Again, speaking back to the whole, the importance of structure, find things that you really like to do and things that will occupy your time and give you not only self-satisfaction, but give you, things that will enhance your sense of self-worth. The more you can do that, the better off, you're going to be able to have that resiliency to kind of take those things that life, sometimes throws at us. Take a quick nap, one of my personal favorites. Love to nap. I think in that short period of time, the restorative powers, are really, really great. Eat something you enjoy. Take a long bath or a shower. Do a midi declutter. It's amazing to me how therapeutic something like that is, even though you would think, it's just too much work, and what's the benefit of like spending all this time? But you'd be surprised, cleaning out a closet that you've been like afraid to go into for like months. Maybe do some spring cleaning, start to downsize, or maybe you're going to take on a minimalist kind of sensibility when it comes to where you live and your environment. That has a lot of really great mental health benefits in terms of not only does it declutter your space, but it declutters your mind. Run or walk for a few minutes. Pet therapy, if you have a pet, that's great. If you don't, maybe think about getting one, or enlist the help of people, maybe members of your family or neighbors or friends that have dogs. Offer to take them for walks or to care for them if the owners are away. Interacting with pets have really, really great benefits when it comes to de-stressing and kind of boosting your mood. And then spend time with real friends and other people who lift you up. I know, because of COVID, this has been a huge challenge for a lot of us. Thank God that we have technology like Zoom. I keep thinking of the pandemic that happened at the turn of the 20th century, and they didn't have Zoom and they didn't have email, and a lot of people probably didn't even have phones. And I often wonder how was that socialization piece, how was that, attended to, how was that looked after? We're so fortunate that we have some tools that we can use, and however that works for you, if you can, if you have access to Zoom, if you can talk to people on the phone, or meet in a socially distanced, responsible way. And if that's something that's really important to you, by all means, make that a priority and figure out a way that you can connect with people, because we find that the loss of connection, the loss of socialization has really been a huge impetus in the increase in the mental health issues that we're seeing both here at Tufts and really around the city and around our state and really around the world. Another idea you can do is you can create a self-care box. Add items to that box that bring you joy, things that you may look at. Maybe it's a photograph of a vacation you were on that you really enjoyed. It could be photographs of people that you love. It could be mementos. I mean, it really is up to you. Think about those things that really make you happy, when you're home. And keep it handy so you can pull it out and kind of give yourself a shot in the arm when you're feeling maybe a little bit disconnected or you're feeling a little bit blue. Pull that box out and just kind of rifle through those things, and hopefully that will give you a good little emotional boost to get you to the next level. Use it when you're mad, use it on bad days, use it when you're sad. At any point where you feel like you need a little boost, sometimes the self-care box can really work. And you know what? Throw some snacks in there too. You can never go wrong with that. So that's pretty much all I have in terms of mindfulness. If anyone has any questions, I'm sure Debbie, Kathy, and I would be happy to answer them.
Yeah. So I just wanted to, Tom, would you mind pulling up the previous slide that has all the self-care practices? Yeah. I mean, the list that you have here, oh my gosh, they're just common sense in a way, but it's just great to have them on one page just to remind us of all the different things that we could do. And I can't help but think how, you're talking about mindfulness and how important it is also to give ourselves permission to do mindless activities. So
Right.
That way we can unhook and be able to just stop the thinking for, or stop being on social media, just to kind of do something. Maybe a lot of people seek a lot of they look for funny memes or watching funny shows. So that way they could just kind of, in a way, just laugh and be able to just forget about their worries. And I do agree with the decluttering. That does, it seems like a daunting thing, but if you give yourself maybe like 10 minutes to just kind of fill a paper bag, grocery bag full of junk that you've been wanting to throw away, it really does make a difference as far as the mental.
It's crazy how that works.
Yeah.
And that probably speaks to the popularity of all those Maria Kondo, guerrilla cleaning and decluttering techniques. I mean,
Yes.
it wouldn't be so popular if it wasn't working for people, right?
Yeah. The thing is, with social distancing, buying a lot of things online is a form of therapy for some people, shop therapy, right? Retail therapy. And, it makes me think about, okay, how much clutter are they going to end up having after the pandemic because of their way of trying to soothe themselves and getting something from someone, even though it's for them, right? Yeah. Now, you mentioned taking a nap. What other self-care practices do you like to do for yourself? You and how about you, Kathy?
Well, I think one of the things that's been very helpful for me is reading and looking things up on the internet because I think it's helpful for me in my resilience and mind feeling mindful is that I can get some resources for myself to help me to relax, to gather more information. Because we're thinking about, we have a little bit more time in this, and I really like to learn more, but too much information can be difficult as well. Too much information can make us stressed out. So it's that balance of not watching the news every 5 minutes and finding out what's going on versus finding information out that might help you. Like the websites that are there, mass.gov has a lot on there that's helpful. So looking at things that will feed you, as Tom said, feed your soul, help you to feel good, reading a novel, whatever makes you maybe escape to a different place might be helpful. That's what's helpful for me.
Yeah, and don't discount like really simple things like exercising, taking a walk. All those activities help increase our brain chemistry that makes us feel a lot lighter, a lot gives us a little boost in our mood. All those endorphins get released, and we feel better. So definitely don't neglect exercise. It really does a lot of really great things for us in so many ways.
Yeah, definitely. And being creative and how you can connect with others. I was just at a meeting yesterday with a group of Boston Hospital Violence Coalition, and we started the meeting by asking how everybody's doing, checking in, because the violence level it has gone up, and so. How are we taking care of ourselves? And one of the members said, instead of sending texts to a friend, they would do a little voice text or a voice message. So that way they're sending a quick note, but using their voice. So if you have that capability on your phone to send like a little short video, hi, how you doing? Thinking of you, type text by on your phone is a nice personalized way to connect with somebody, or even maybe writing the old-fashioned letter, snail mail, writing to somebody, and allowing yourself to just kind of write what you want to write, and then sending it to somebody. So it's really a nice gesture. Yeah.
It's tough. You see people in the grocery line snapping because they're stressed, or somebody said that they were at Lowe's and a person really yelled at the checkout person it appeared for no reason. So your anxiety might be high, which might make you a little agitated. I think, Debbie, that was, you were talking about the violence being a little bit higher than it had been in the past. So if you find yourself getting anxious or agitated, really being mindful of that and looking at it. And as Tom said, don't judge yourself. This is, how you're feeling, but how are ways to bring that back down? So you yourself aren't the one, getting agitated in the line at Shaw's or Stop and Shop.
Yeah. Yeah. What are some ways to help us? Kathy, you talked about grieving. What are some ways for us to be able to navigate during these times with our grieving? What are some ways that you can think of to help us during these times?
Sure. What I'm finding is that people are having this prolonged grief process because they haven't been able to come to some resolution on what's happened. So a person may have died, a year ago, and because they haven't been able to reach out to families and friends, that long period of time where you're feeling sadness is making people feel depressed. So one of the things you could do is reach out to a professional. If you are in that process where you're feeling like you can't take care of your hygiene, or you can't get out of bed, if you're not eating, if you're eating too much, if you're having feelings like, life isn't worth it anymore, that's the time you really need to reach out to someone. Your safety is very important. And I can see how that happens. I see that people haven't had their outlets like these things. They haven't been able to go to the gym, or they haven't been able to leave their house. And it's scary. Let's face it, it's scary. And so there are people out there for you to connect with if you're feeling like this is too much for you. You could call you could go to the emergency room. You could call a provider. If you can't get a provider, reaching out to someone like the emergency room, or calling 911 if you're feeling very, very, very sad. The other things is, looking at pictures of loved ones, maybe making those phone calls to people also who are grieving can be very helpful. Being with people in the moment that understand your pain. That's what someone said to me yesterday. She had lost someone, and she said, I don't have anyone that will sit with me right now and feel this pain. She had lost a parent before. She's lost her other parent. And so I recommended she talk to the chaplain. And she said that's so helpful, because sometimes people feel like spirituality really helps them. Someone told me recently that a therapist just told her to give your pain to someone else so you can sleep. So let someone else, maybe that person that passed away, maybe God, if you believe in God, or someone spiritual, can hold that pain for you while you're sleeping. She found that to be very helpful. But a chaplain, a religious provider, whoever, a spiritual person might be able to help you cope also with that, because sometimes people can't relate. And you want somebody that can sit with you in the pain. And that's hard to find someone sometimes, because other people may have moved on and you haven't been able to move on. And that is something I'm seeing, that people just haven't been able to have closure. And that's it's a big deal not to be able to have closure. Being able to be with somebody who can feel that pain, or just listen to you without judgment, I think is invaluable.
Yeah, I totally agree. I mean, having somebody just sit and actively listen with an open heart without trying to fix you can be so healing. And, I can tell you personally, as a nurse, I went into nursing because I wanted to make people feel better. What's the problem? I'll take care of it. That's me. I got to make you feel good. I got to make you feel better. And that is a lifelong practice for me in mindfulness, to be able to just sit with somebody with an open heart without opening my mouth, without trying to say, oh, everything's going to be okay. You'll be fine. Or, I'll get you something. You want a cup of tea? It's just, I need to sit with that person who is trying to sit in their pain. So that way I could just be there for that person. So it's hard. It's hard for people who mean well. And at the same time, if I could add, noticing in your group of people also who may be struggling and trying to reach out. So you mentioned checking in with yourself, and if you're feeling low and depressed, to seek medical attention or a professional, but also checking in with the people that you're connected with and seeing how they are. Maybe they might need to seek help, right? So maybe giving them, that sort of, like a gentle advice.
Just want to throw out there's another really good website, which actually is where is the content of the slide presentations from this organization. It's called the Bounce Back Project. And it's a multidisciplinary organization of all different types of healthcare professionals, whose main focus is on happiness through well-being and healthcare. So if you're interested, it's bouncebackproject.org.
Oh, that's great. Thank you. So Tom, would you mind, is there like one particular mindfulness practice that you could share with us, that you love to do yourself, or even like to share with patients that you feel has been very effective?
Mm-hmm. For myself, when I have to kind of de-stress or I really try to stay in the moment, I really find like listening to like music really helpful for me. In this particular case, it would be more of a more classical stuff where I don't have to think about lyrics or, and it's a little bit more calming than some maybe the other types of music I like to listen to. But I find that when I kind of put that on in the background, and it helps me kind of get back in touch with myself in terms of being able to think what's going on in the moment, and I just find it really helpful. I also like to paint, so sometimes I found that just get in front of a canvas and some brushes and paint, that really helps me kind of. It's a very meditative process. It was kind of this kind of Zen experience, where you just all of a sudden become so focused on what you're doing that whatever you were struggling with prior to that, it just kind of dissipates, and you are able to be in the moment via that particular practice.
Mm-hmm.
I think people like that Calm app that you can put on your phone. Yeah, I'm hearing a lot of people going to sleep with that. A lot of people like that. There might be a fee connected to that. I'm not exactly sure, but it's a meditative tape that people love, and that helps them to fall asleep.
Mm-hmm. Kathy, besides reading, is there anything else that you like to do to help you with the self-care or to relax?
I love to take a bath. I love to talk to my family on the phone. I love the phone too much, and I love to talk to them. I love to laugh, make jokes. And, we do Zoom. Sometimes we do Zoom cocktail parties where we all get on the computer, and you can even have full dinners with friends and family, which is fun.
Gratitude is really important. that to just sit down and in spite of all the stuff that's happening in our world and in our communities, that sitting down and just being grateful for the positive things. I know that helps me a lot when I start getting overwhelmed with, whatever it is in that particular moment. If I can sit back and say, all right, this isn't happening, but I still have this, or I'm grateful for that. I mean, for me, it really puts things into perspective because, we kind of get so tunnel vision sometimes, especially when we're on a particular, issue or topic that's really causing us a lot of stress. Just kind of like putting that aside and just realizing where we are in the moment and what we have to be grateful for, it kind of puts things into perspective.
I totally agree. I was watching a video on YouTube. They were interviewing Jon Kabat-Zinn, and he said that if he was to rewrite his book, Full Catastrophe Living, where he introduced 7 approaches to mindfulness there, he would add 2 more approaches, and one of them would be gratitude, and the other being generosity. Because gratitude is a nice approach to mindfulness. It gets you in the present moment, and it really builds the positivity level. And it's something that I love to practice because there's such grace in that. And there is always something to be grateful for, even in the midst of chaos, right? Whether it's as simple as being able to breathe easily or walk away from that chaos or have a home to come home to. Right. Always trying to find what we can be grateful for is so important. So is there, we're at the top of the hour, and Kathy, I didn't mean to cut you off. Please, say what you would love to say.
Well, just real quick, I think gratitude is contagious. Yeah. When my daughter texts me and said, "Oh, Mom, I'm so grateful for X, Y, and Z," I think, "Oh, I'm grateful for X, Y, and Z." And it's very uplifting. It's contagious.
Yes, I totally. And also, there was one year where I decided to do a gratitude journal, and I did it for over a year. Mm-hmm. And the way I was able to do it was because I really wanted to do it because I heard such great things about it. And the way I did it was I put my gratitude journal on top of my pillow, and I put my pen right there. So at the end of the night, before my head touched my pillow, my gratitude journal was waiting for me, in a way kind of asking me how my day was. So it really became a nice habit for me to be able to cultivate gratitude in that respect. It's a nice way to end the day on the positive. Yeah. So I want to thank both of you for being here with me today, Kathy and Tom. I learned so much from both of you, and their topics are so timely during these times. And I can't wait to be able to just kind of think about and reflect upon what we covered today, because it's so important for our mental health wellness. So is there any one lasting bit of advice that you would like to share with us before we end the program today? What's the one thing that, if we were to do it today, can make us feel good?
Well, I think the gratitude thing would be a great way to start. So I'm going to say how grateful I am that you invited us to do this, Debbie, because I learned so much too. And it's going to give me some things to reflect on. So honestly, I really think I'm going to be able to sit back and think a lot about how to be more mindful about how I'm taking care of myself. So thank you very much for having us here. Clayton, we appreciate that. I really enjoyed this. Thank you.
Thank you. How about you, Tom?
I would say connect with somebody today that makes you feel really good.
Mm-hmm. Definitely. Yeah.
Connect with somebody that's really going to be a good thing for you today.
I love it. Thank you so much. Again, Kathy Tora McHugh, Tom Gunning, thank you so much for joining me today in the Falls Prevention and Stress Management Program. Again, thank you, Clayton, for having me here. And everybody, again, take care and be well.